Hello, good evening, everybody. Good evening, good evening, good evening, good evening, good evening, good evening. I hope the light is not so good evening. So, if you are joining and you can see me very well, and you can see me, let me see if I can change the light. Am I the one seeing? I'm seeing kind of a halo behind my head. I hope that's not disturbing to you guys. All right, good evening. Good evening. Try to see if I can change. Okay, this looks better to me. I don't know. So if you come online, let me know if this is clear, if this is okay, or I should increase that. Okay. All right. Try now the lights and all that. So this seems okay. I don't know if okay. All right. So let me know if this is okay. If you can see me very well. If you can see me, hear me, and all that. All right, good evening, everybody. So who is joining me live today? Okay, wow, it's been an amazing time. Okay, so somebody is online, so let me know if you can see me very well. Am I bright enough, or should I increase the illumination? And can you hear me? Can you see me? Can you hear me? Please, you can just quickly type and say I can hear you, I can see you. It will definitely help me to know that everything is moving well. So if you can just tell me I can hear you, I can see you, you are in the middle, you are not because I kind of feel as if I'm slanting here. All right, so I look okay, I can see myself very well, and I hope you can see me very well too. I hope you can hear me. Alright, so if you're joining us, my name is Dr. Doris. I am an optometrist here in Akwa Ibom. And yes, this is Eyecare Online, episode 11. Alright, and my sincere apologies for not coming online yesterday. It was due to circumstances beyond my control. But we are here today, and we have a couple of things we are going to be discussing. And I tried to narrow. I saw lots of topics when I asked, when I made a post asking you guys for the topics you want us to talk about. Lots and lots of topics we are sent in, so I had to group them. And then the one that is most common is glaucoma. People want to know more about glaucoma, and I don't blame anyone that wants to know more about that disease, because that's the number one leading cause of blindness right now. So it's something very, very serious that we should talk about. Then I also got some questions about pepperish sensation, dryness, sandy sensation. So I'm going to also talk about that. Then I have a particular I have someone that sent a question that is unique, and I also want to address that. Now I informed you guys that there will be an announcement, right? And I'm going to give the announcement towards the end of this particular episode. Okay, so let's get down to it. So I'm going to start with the unique question, and the reason why I picked this question is because there are certain things I want us to talk about, that has to do with that question, and it's something that I feel that we should know about. So please, if you can hear me, see me, kindly let me know so that I can talk more confidently, because now I feel as if I don't know whether you guys are hearing me or you're seeing me very well. So if you can see me clearly, let me know. If not, I can increase the illumination of this light. All right, so I need to know about that. Okay, so this question came from Iyabo, and then I have to paraphrase what she sent so that it can easily be explained. She said, I am always having eye pains even after getting glasses. All right, so Iyabo's story is that she was experiencing eye pain, then she went and got glasses, and even with the glasses she's still having eye pain. So now, first of all, I don't know if Iyabo went to an eye clinic to get glasses, because I know that many of us have this we have this thing of going to the market. Some of us can go to the market, and people will just be putting lens, adding and removing, and ask you which one is better and which one is clearer. And there's some people have this mindset of, let me get the number of the prescription, and then we'll now go to the market and fit it. Please, please, please don't do that. If you are one of the people that do that, you have to stop. When they keep putting lens in your eye in the marketplace, putting and removing, what they are doing is trial and error to see the one that to them you are seeing very well. There is a whole lot more that go on before glasses, before prescription is generated for you. There is a whole lot. Sometimes you find a situation whereby both eyes are not the same. Hi, Blessing, good evening. I can see your comment, I can see your question. I'm going to answer that, but I want to know if you can see me and if you can hear me. Kindly let me know that. Okay, so now sometimes we have a situation whereby the prescription on both eyes are not the same. So you find out that in an eye clinic, when you go to have tests for glasses done, a good eye clinic is going to test each eye individually. They are going to run certain tests. Sometimes we may do something we call fogging. There are so many things we do to generate a prescription for a patient. We don't just do trial and error. We do lots of tests. We do retinoscopy. We do auto-refraction and all that. So if you're one of those that just go to market and collect glasses, you are bound to have headaches. You are bound to have problems. Sometimes the headaches and the issues may not even be immediate. It can take like a couple of weeks or 2 to 3 days, and they start experiencing headache, heaviness, and all that. So number one thing I'm going to say to you guys is, please, if you want to have your eye test done, go to an optometrist. Ask the person that is doing the test, who is he, right? Is he a licensed optometrist? Okay, don't just go to the roadside and then just give your eye to people to play with. It's not safe. It's not safe at all. And these eyes are very, very precious. So that being said, if you had gone to an eye clinic and you got glasses, now we expect that within the first 7 days you may have a little adjustment issues, especially if you have not worn glasses before. In that case, if after 7 days you are still uncomfortable with the glasses, or you're still experiencing the same problem that took you to the clinic in the first place, please go back to the clinic. Many clinics have return policy, in the sense that if they give you glasses and you're not comfortable with it, you have certain maybe for some clinics, like for my clinic, there are some glasses that you will get. You have warranty of 6 months. Anything that happens to you, or you're not comfortable with the glasses, anything happens to the frame within 6 months, we are liable to change it for you, without extra charges. There are some glasses that you get is 1 year. So many clinics have similar policy. So you have to find out what policy does the clinic have. And anybody that gives you, any optometrist that gives you glasses and you are not comfortable with it, take it back to that person. Report back. Let the person change it for you. Let them review the prescription and whatever it is that's going on in your eye, and give you the right prescription. So if you were having eye pain before you went to the clinic to have your test done, and even after you've collected glasses you are still having eye pain, please go back to that clinic. So Iyabo, I hope when you listen to this, it will definitely it will be clearer to you. And if you have further questions, please reach out to me via the comment or DM, and I will answer that. Now let's talk about pepperish sensation, dry eyes, sandy sensation, excessive tearing. Now, there's something we call dry eye syndrome, dry eye disease. Okay, dry eye disease is a situation whereby, how do I explain this? The tears your eye is producing is either not adequate or it's not in the right proportion. Our tears, these tears that fall from our eyes, are made up of 3 properties, right? I'm trying to explain this in the simplest way. We have the lipid, we have the oil, we have the mucus. Now, the thing is, if your eyes are not producing the appropriate quantity of tears that it's supposed to produce, or if your eye is not producing the right quality of tears, you are bound to have a dry eye disease. Now, dry eye disease encompasses so many other things that have to do with cornea, but let me go back to let me go into what we're talking about. If you are experiencing dry eye, now the question is, what is causing this dry eye? Let's start from there. If you're always on phone, you are always working on your phone and on your laptop, sometimes in the course of working on our phone and laptop, we experience what is called digital eye strain. Digital eye strain is as a result of prolonged exposure to phone, to phone light. So because of that, you can actually experience dry eyes. Okay, now because the more you keep staring at the phone, the less you blink, and when you don't blink as often as you're supposed to blink, you end up having dry eyes. So what do? You should try to blink as much as possible. That part of the reason why we have what they call the 20-20-20 rule, which states that for every 20 minutes you spend on your phone, you should look 20 feet away for 20 seconds and then you blink. All right, when you do that, what it does is that it helps your eyes to moisturize. It helps moisten your eye, because when you blink, what you're doing is you're moistening your eye, right? So but most of the time when we keep experiencing, or when we keep exposing ourselves to prolonged use of phone, we don't blink as often as we should, and that is a problem. So if you're always experiencing peppery sensation and dry eyes, sandy sensation and tears, if you go to the eye clinic, they are most likely going to recommend an eye drop for you. Now this eye drop, they are in different formats, right? Sometimes some of them will just lubricate, and after the eye drop is over, the issue comes back, while some of them will identify what exactly is wrong. Let's say one of the properties of tears is not adequate, that it will go and handle it. The best way to know exactly what you are struggling with is to perform what we call a dry eye test. Okay, your clinic will perform that before they now issue you the right eye drop. That way you're not wasting your money doing trial and error to know which kind of eye drop to use. Then what else you need to do is you need to get a blue cut lens. A blue cut lens will help to protect your eyes from the rays of the phone, right? So that even if you happen to be lost in what you're doing, you don't have the entire rays from the phone going into the eyes. So if you're experiencing digital eye strain, you can also have dry eyes. All right, so I hope that answers that question as much as possible. So now let's get into the main topic of tonight, which is glaucoma. All right, now for those of us that ask about glaucoma and all that, I'm going to do the best I can. I know I've handled it when I did when I began Eyecare online. That was the first thing I talked about, so I spent a couple of almost an hour talking about it. Unfortunately, I don't know where that episode is. I'm going to find it and put it up on in the YouTube, so you can also go and check it out. So tonight I'm going to break down glaucoma as much as I can into different topics, right? Into different subtopics. Okay, so first of all, let's understand what glaucoma is. Okay, so first of all, glaucoma is a condition that causes damage to the back of the eye. So let me drop this so that I can actually explain what I mean. Now let's assume that this is the back of the eye. Okay, so the back of the eye is called the retina, right? It's, let's say, the palm of the hand. You can see where the vessel, let's say the vessels went this way, right? Now when there is pressure in the eye, for example, if you are using let's say a balloon, you blew air into the balloon. By the time the balloon gets to a particular size and air is still being forced into it, what will happen? It will burst, right? So the same thing with the eye. The eye is meant in such a way that there should be a seamless circulation of fluid within the eye. When that fluid does not move as smooth as it should, it causes a blockage. So more like the eye adds there is pressure in the eye. That is why they tell you that glaucoma is linked to increase in eye pressure. Okay, so most times when you find patients that have glaucoma, the pressure is high. Not all the time, most times. When you have people that have glaucoma, the pressure is high. So when this pressure is high, it affects the back of the eye. It eats it away. It eats away the retina, right? The parts of the retina that actually gives image. So in other words, what I'm trying to say is that glaucoma is a condition that causes blindness. Full stop, right? So there are risk factors to this glaucoma. First of all, if you are diabetic, you stand at a risk. If you are hypertensive, you are at a risk. If you are overweight, if you have refractive error, if you are above 40 years, if you have family history of glaucoma, right? All these things are risk factors of glaucoma. Now, remember I said glaucoma is linked to increase in eye pressure. Now, when you have this high increase in pressure, like I said, it will kind of create an opening, because the pressure have to go out somehow, right? So the problem with this is that there are certain times that people that have glaucoma don't even know they have glaucoma. So that takes me to the three common types of glaucoma. There are many other types of glaucoma, but these are the common ones. Okay, we have the open angle glaucoma. This is the one that we call the silent thief of sight. It doesn't cause any pain, it doesn't cause any sign, you don't even know that you have it. It's gradual. It's like a thief in the night. Actually, it's coming gradually, you don't even know. Sometimes before you know it, it's been there for like 10 years. But and that is one of the most dangerous type of glaucoma, because you don't even know. Now, this is why we tell people, don't wait until something is wrong before you go for medical tests. With open angle glaucoma, you don't know. So if you have family history of glaucoma, or you are above 40, or yes, another risk factor of glaucoma is trauma, or somebody hits you in the eye and all that, or you've been hypertensive for some time, you've been diabetic for some time, you need to go have your eyes checked. Because if you have open angle glaucoma, you will not know. It will be a case of, I went to bed and I woke up tomorrow morning, I cannot see, right? So it's terrible. The second most common type of glaucoma is the angle closure glaucoma. That I would say is better, because it's not. But this particular one gives you sign, and the sign can be so sudden, and not just that, it doesn't give you time. Open angle gives you time. You don't just realize you're losing your vision. Angle closure does not give you time, and you realize you're losing your vision. Okay, that one is characterized by intense pain. You have this severe pain. Some people will tell me that it's like they are on the bike and an insect entered their eye. Some people will say, I bent down, I was cutting something and something hit my eye. Nothing hit your eye, it's your eye shutting down. So you have this intense pain, like the pain is so bad that you have the person closing their eye with tears coming out, with redness. That is angle. At that time, it means that the angle has closed instantly. The bad part about this glaucoma is that whatever we do, no matter what we do, vision loss due to glaucoma is irreversible. That's the bad part. So in open angle, you have time to detect it early and seek early intervention so that you don't lose vision. In angle closure, you don't have the time. As soon as it hits, even if you are treated immediately, your vision never remains the same. And that is terrible. Alright, terrible. Then the third other common one that we experience is the normal tension glaucoma. That one, the pressure is normal, but the back of your eye is being eaten away by other diseases. Okay, so that also is another form of glaucoma that is terrible, because if you rely on just the pressure test alone, you find out that you may miss it. So I'm going to talk about different ways that we can diagnose glaucoma. But first of all, I want us to understand something. There is open and there is closed. In open, no pain, no sign, nothing, like you don't feel any different. In closed, there is severe pain, so severe that no matter the paracetamol you take, the eye is so red and water is so coming out and the light is affecting the person. Those are the three most common types of glaucoma. Then let's talk about the people that have glaucoma. I'm talking from a practitioner's point of view. When people come in and I'm talking to them and ask them, how is your vision? Those that have glaucoma, one of the things they tell me most of the time is that their vision is getting dim. Right? The vision is getting dim. And what happens is that when you have glaucoma eats away the side, your peripheral vision. What that means is this. Let's say, for example, like I am facing you guys right now, and an object is coming by my side, I won't see it. If I have glaucoma, I won't see it. If I have anger, I won't see it, right? So you find out that the person is seeing very well straight, but anything that's happening by the person's side, he or she is not seeing it. So the entire peripheral vision will keep being eaten away. That's one of the bad parts about open angle. Now, if you are very, very observant about your vision, that's why I tell my patients, and everywhere I have an opportunity to talk about the eyes, when you wake up in the morning, just place your hand over your eye and then look. Have an object, maybe from your window of your room, or from the door. You can pick a palm tree or one of these telecommunication masts, something that you can actually see very well. I prefer using palm tree or some people's houses, so I can tell the windows, I can see those details. When you wake up in the morning, place one hand over your eye and then look at the palm tree. Yes, my son is coming. Look at the palm tree, all right? So see if you can see those palm trees, like the fronds, whatever it's called. Or if you are using somebody's house, make sure you are seeing the window. So pick the farthest you can see. Wake up in the morning, you look there, you do this, both eyes, close one, check with your left, check with your right. You can do that once a week, you can do that twice a month. So that anytime you wake up and you do it, and you find out that you're not seeing as you used to see before, it's a sign. It's a wake-up call to check out there's something wrong. All right, so that way you'll be able to monitor your vision from your own house. Okay, so like I said, one of the things they complain most is the dim vision. Then for those of them that have angle closure, they also talk about the pain and the redness and all that. So basically we have handled what is glaucoma, the risk factors of glaucoma, and the common types. So now, how do we diagnose this glaucoma? When you go to the clinic, there are 3 common tests that we do to actually diagnose glaucoma, and most times we need 2 out of 3 of them to confirm. Okay, the first one we do is what we call the fundoscopy by examining. It's called internal examination. Let me not use big grammar today. Internal examination. All right, so that's what we do. We check the back of the eye to be sure that the back of the eye is healthy. All right, so if we check the back of the eye and it's not as healthy as we want it to be based on your age and other conditions, let's say you are not hypertensive, you're not diabetic, you don't have refractive error. So if you check the back of your eye based on your age, then we now also, if we don't like what we see, we do what is called tonometry, which is checking the eye pressure. Please, checking of eye pressure is not the same thing as checking the body pressure. Okay, it's different. We check the pressure of the eye. If the pressure of the eye confirms that what we are seeing at the back is not good, then we can now say you have glaucoma. So we have checking the back of the eye, checking the pressure, and then we also check how well you can see all around you. These are the 3 tests that we do to confirm if somebody has glaucoma. So now, remember what I talked about normal tension glaucoma. If we check the back of your eye and it's not healthy at all, and we check your pressure and your pressure is normal, then we are bound to do the 3rd one, which is checking how well you can see. That will decide for us if you actually have glaucoma or not. Okay, so in most cases when you go to the clinic and the doctor says you have glaucoma, please feel free to ask him or her which type, because that will help you to know exactly what kind of test you need to run if you need to run further tests. How do we now manage or treat this glaucoma? There are 2 common ways we use to treat the glaucoma or manage glaucoma. Like I said earlier, sorry, 1 minute. All right, like I said earlier, any vision loss due to glaucoma is irreversible. Any vision loss. Okay, so what we try to do is detect it early and begin the management. Now, how do we manage? We use mostly eye drops. Okay, what does the eye drop do? The eye drop helps to reduce the pressure in the eye. So if you have glaucoma, the first line of treatment that your doctor will recommend for you is eye drop. If the eye drop is not giving us the result, or is not bringing down the pressure as fast and as well as we want it to be, we can now recommend surgery. In many cases, or in most cases, even after doing the surgery, you still need to be on eye drop, right? But not in all cases, and it depends on who did the surgery. So sometimes we look at the patient's age, look at, if you are still young, and then we know that glaucoma is a lifetime issue, right? So I can advise you to go and do surgery and then use the eye drop to maintain it, so that way your vision is maintained. I've seen on social media people saying drink tea for glaucoma and all that. Please, we really need to be very, very careful. Very, very, very careful. Any medication that does not undergo research, let's be very careful what we ingest, okay? And if you have had glaucoma and your vision is lost, anyone telling you come and bring this, I'm going to restore your sight, please be very careful and make sure that you're making an informed decision. In a nutshell, glaucoma is not something that you want to have, and the only way you can actually manage it is by detecting it early and then managing it effectively. If your doctor prescribe an eye drop for you, I always tell my patient, anytime they come for pressure tests, I make sure that they go with a copy of the pressure test while I keep a copy. That way you will also know your pressure anytime you can, because sometimes we tend to come every 2 weeks or every month. You'll be able to know by yourself if the eye drop is actually effective, right? If they give you an eye drop today and you come back and the pressure is still the same, that means the eye drop is not that effective. So you may need to go through 2 or 3 eye drops to find the one that best works for you. So be involved in your own management. Don't just leave it entirely to the doctor. The doctor will be managing about over 300 cases on glaucoma. Be involved. Be involved. At the end of the day, it's about your vision, it's about your sight. All right? Okay, I think that is all for glaucoma. So let me answer Blessing. Blessing Chukuma saying, good evening, my case is severe itching of the eyes, especially those pink colored side. Pink colored. Okay, that should be here. And it's sometimes teary. I don't know why this is not coming up. Okay. All right. Okay. So Blessing, itching. I've handled itching a couple of times. Itching can be as a result of allergy or refractive error. Okay. Allergy in the sense that there's something you are allergic to, either your cream, your soap, your detergent, whatever it is you're using. There's something you are allergic to, so you need to find out what it is. Okay, so you find out what it is, you stop exposing yourself to that thing. But in the meantime, go and visit your eye care practitioner. They can give you either an antihistamine eye drop, or what's the other word? I'm trying to find the other word. Or a mast cell stabilizer. Yes, they can either give you antihistamine or mast cell stabilizer. That will definitely help with the itching. It will definitely stop the itching entirely. But if you are still exposing yourself to what is causing the allergy in the very first place, the itching will definitely come back. So if you're having itching, go to your doctor. He or she will prescribe the right eye drop for your eyes, and then the itching will stop. Announcement, right? Okay, so my announcement is quite simple, and it's something that I want my own way of saying thank you to you guys. So Thursday, I'm celebrating my birthday on Thursday, and I'll be doing a giveaway. So on around 12 noon, I think it's 12 noon, there will be a question that will kind of pop up, because I'm going to schedule it. I will not be online on Thursday. I won't be online on Friday. Okay, Friday to Sunday, I'm taking a vacation until Sunday evening. Until Sunday or Monday. Yes, Monday, sorry. So I'm taking a mini vacation from Friday to Sunday. I will resume on Monday. The question will come up on Thursday on my birthday. And the question, whoever gets the question correctly first, the person that gets the answer goes home with a complete computer kit, computer glasses, the blue cut photochromic in a very beautiful frame. If you're a female, a very beautiful sexy frame. If you're a male, a beautiful and handsome frame. Okay, the computer lenses and all that, with the liquid cleaner, everything, because we want you to protect your eyes as much as possible. So I'll be doing a giveaway of computer digital kits on Monday. I'll announce the winner on Monday during Eyecare Online. So just watch out for my timeline on that Thursday between 12 noon and 2 p.m. The question will come up on my timeline. The first person to answer that question goes home with this. Okay, so I hope I've answered everyone's question for tonight, and from next week we'll continue. I saw other questions, other topics, myopia, all of that. I'll be handling them one after the other. So I want to say thank you to everyone that tuned in tonight. I hope you got value, and then I hope that you now know how to handle glaucoma. I hope you now understand what glaucoma is about and what it's not. Let me say this thing: you cannot tell if someone has glaucoma by looking at that person. For someone to be diagnosed of glaucoma, they need to run the test. Okay, so those things of your neighbors telling you I see glaucoma in your eye, it's not glaucoma. Please, it's not. So thank you so much for watching tonight. Thank you for being part of Eyecare Online episode 11, and I'll see you guys on Monday. Let's have a good night rest.